Hello, my name is Gary Perkins. I'm the Community Relations Advocate for Family Life Center, and with me today I'm sitting down with Trish Giacconi, CEO of the Family Life Center. How you doing today, Trish?
Pretty good, pretty good.
Yeah?
The Family Life Center is hosting our very first Facebook Live event.
Right.
And Gary and I wanted to put this together so that we have an avenue to share with our community what's been going on in Flagler in relation to sexual assault. April is Sexual Assault Awareness Month, and what's going on with our domestic violence program as well.
Well, and it's unfortunate that COVID-19, kind of overwhelmed us as Sexual Assault Awareness Month was going on. We had a lot of plans. We had to walk a mile to bring in Sexual Assault Awareness Month, which we had to postpone. There's no news on information about that.
Actually, I just got an email this morning from the city of Flagler Beach, and we are going to have to postpone it even further out. And so we don't have a makeup date yet, but we will let the community know once we do. It is an event that we look forward to help, like Gary said, kickstart Sexual Assault Awareness Month. It's always fun to see those guys in those red 4-inch high heels, and I was really looking forward to having Gary in them this year.
Yes.
So maybe we can make it happen later in the year. So we'll try, but we don't have a date for that yet. The unfortunate part about canceling our events, as many of you know, is that not only is it an awareness event, but it's also a fundraising event for us, and so we certainly are going to have to figure out how we're going to raise funds in other ways. But yet, like many of you, we are struggling with the safer at home and COVID-19. I am very grateful that my family is doing well and we are not experiencing any symptoms. Not just my personal family, but the Family Life Center family is doing well. None of our team members have been experiencing any symptoms. And so we are so grateful for that. All of the families that we are supporting in our emergency shelter are also doing well. There are no symptoms in our shelter, thank God. And yes, we do have families that are residing in our emergency shelter during this time. And so we are taking precautions. We are asking folks about their symptomology, when they call if they're seeking services. But we will not refuse services to any victim in need, regardless of whether they have symptoms or not. We are in close conversation with our Flagler County Health Department to let them know what our plan is if someone were to develop symptoms. And so we are taking every precaution we can to make sure that we're keeping our residents safe, our staff safe, as well as our personal families. So
for sure. For those that have never been to our outreach office, this is it. It's a little bit quieter. Honestly, a lot of our outreach staff is working from home, obviously, because we want to slow down the rate that COVID-19 is spreading, and we want to make sure that we're doing our part to keep our families safe as well. So there's only a couple of staff members that come in occasionally to make sure there's no left mail, packages, donations get delivered to the right place. So we appreciate everyone's support. But yeah, COVID-19, it's had a lasting effect on us. It's only been a month, but it seems like it's been 2 years. I mean, I don't know about you, but...
Well, it's interesting. I was talking to a staff member earlier today, and I said, I thought last year was tough because we had the government shutdown, and we were kind of scrambling, and then you finally get your rhythm going, and then 2020 starts and says, ha, 2019 was nothing. Here we are with COVID-19. Right. So the last couple of years have been interesting for all of us, and it certainly changes the way we provide the services that we do. We still provide them, we just have to amend them and figure out more creative ways to do it. And for those of you who know me know, I'm not afraid to talk, but generally I speak live, like in person, much better than when I have a camera in my face. So I'm actually having a moment struggling right now that I'm doing this live, but we are exploring new avenues, and so I'm testing my own personal boundaries as I do this. But anyways, which is why I have Gary here with me to help me out in case I get stuck and stutter. So I guess it's a time for great learning and really an opportunity for us to look at things in a different way and try to bring things in a different way. So one of the things that we wanted to talk about is Family Life Center is still here. Our doors are open. We are providing services to victims of rape and to victims of domestic violence. We know that the Safer at Home mandate doesn't really mean it's safer at home for everyone. And so we want people to know that they can still call us on our 24-hour crisis helpline, 386-437-3505. We have advocates that are really waiting to talk to you, that they are kind of bored out of their mind. They're looking for someone to talk to. But it doesn't mean that you have to utilize our emergency shelter. Sometimes you just need somebody to talk to and talk through things with.
Advice.
And so that's what staff is there for, so that we can talk about safety planning and what happens as we're going through this, and can we go through this together, and what does it look like when it's all over, and hopefully it'll be over soon.
All right.
And what other resources are available to you in the community as you're navigating domestic violence and COVID-19, or sexual abuse and sexual assault and COVID-19.
Now well, actually we both got off a conference call with Sheriff Staley,
Mm-hmm.
and the last pretty much sentiment that he made was about domestic abuse,
Right.
and the rise of domestic abuse here in the county.
Mm-hmm.
And he was just adamant about everyone on the conference call making sure that they are aware and they keep their eyes open and keep their ears open to any crimes that might be committed during the stay-at-home mandate. And I believe you see it not just here in Flower County, but nationally on a national level. You have a lot of people that are they're stuck in the house, so they don't have those avenues.
Right.
So they can't go get their nails done and talk
Right.
to
To the manicurist.
yeah, or
yeah.
go to a hair salon and
Well, it's even
really
tough for
have that real talk, or-
but it's even tough that we're finding people are having a hard time reaching out to family or friends.
Mhm.
And so there's this isolation that's happening just in everyday life. And so what we want to make sure that people hear is that you are not alone. We are here. There are people that want to work with you and support you and provide information. And I have to say that the conference call this morning by Sheriff Staley, when he said, that domestic violence is on the rise, I mean, we get the police reports. We are seeing law enforcement respond. We want victims to know, we want survivors to know that we are here for them. And it is important that they know that 24 hours a day, 7 days a week, that we're here, even through pandemics. I mean, this is the first one I'm living through working at Family Life Center, so, but we are here, and we're here to support.
Trish, can you explain to our viewers what the procedure is for acquiring our services during this time?
So, first thing is we want survivors to give us a call and let us know what services they're looking for. We don't mandate or require anyone to do anything that they don't want to do. If they would like emergency shelter, then clearly we will make a plan to help you get to our emergency shelter in a safe way. But let's say you just want emotional support and safety planning, and you don't necessarily want or need our emergency shelter right now. Just give us a call on our hotline. Again, that number is 386-437-3505. And an advocate will walk with you and really try and figure out what you're looking for. All of our services are free. It will not cost you anything to give us a call and for us to listen to you and hear you out.
As well as free, they are confidential.
Oh, and they are confidential and more than confidential. And it's that our advocates are privileged advocates, and that's by Florida statute. So our advocates, we take that very. Sorry, I got a phone call in the middle of that. Just as if you were to speak to your pastor, your priest, your doctor, and that information is confidential, it's the same when you speak with a privileged advocate. So we want to make sure that you know that what you say to us stays with us, unless you explicitly tell us otherwise and put that in writing. But your information is completely confidential.
Definitely. So they give us a call and we find out what services they, just get the feel for what services that might benefit them.
The biggest thing that I want to share is that we're going to ask about your safety immediately, because that's important to us. And so if there's an immediate need, please don't hesitate to call 911. You can call us as you're waiting for law enforcement, but if there's an immediate need, we don't want to circumvent 911. So you can definitely call law enforcement. But if you're in a situation where it's not safe, it's unhealthy, and you want somebody to talk to and talk through some things with, you're welcome to give us a call. Once we assess your safety's okay, and that you're in a safe place to talk, then we can have further conversation with what you'd like to discuss.
And for those that don't know, I'm one of the newest advocates to Family Life Center. And so, this is a different realm for me. So going out and connecting to the community just really opens up my eyes and my ears on, what kind of stuff actually happens here in the county. I think a lot of people think that this is paradise, and oh no, domestic violence doesn't happen here, sexual assaults don't happen here, but you see it in the news now. I applaud some of the news outlets because they're writing stories and capturing what's going on here. So for anybody to say, oh well, it doesn't happen here, they're wrong.
Yeah. It happens here, and it's been happening here for some time. Family Life Center has been around since 1987. And we wouldn't have been here this long if we weren't needed. So we are needed, we are here. And frankly, if you know someone who has been a victim or is a victim, or you were a victim and you are being triggered by something, you can give us a call. Gary and I, just before we started doing this live, we were just talking about being at home and being isolated and maybe watching something on television or seeing something that triggers you. That can bring up some really damaging memories, and so we want to be able to support you through that. So you're welcome to give us a call as well. Support doesn't mean that your domestic violence had to have happened within the last 24 or 48 hours. If you are a victim from at any point in your life and you need support, by all means, like I said, give us a call. Please don't hesitate. You can reach us on our hotline. Again, I'm going to give it to you. It's 386-437-3505. You can also reach out on our social media platform, and I'm going to be real honest with you and tell you I'm not real tech savvy. I love the fact that Gary is, but we do monitor those, and we do have advocates that are paying attention to that, and we'll try and respond as quickly as we can. But we want you to be safe, and please know that technology can be monitored by perpetrators of abuse. So please make sure that if you're reaching out to us, that's a safe avenue to give us a call. We are working on a method in which we can have texting to advocate. Again, I'm a little slow on the upkeep. I'm working on it. I just want to make sure that is handled in the most appropriate way, and it's confidential as well. But the minute that we have that, we will certainly share that with our community.
Thank you so much, Trish.
You're welcome. And so I was going to say hang up, but before we leave, one of the things I want to say is that Gary and I are thinking about doing kind of Facebook Live every couple of weeks or something like that. We're not exactly sure how often, but we want to hear from the community. We want questions, things that we want to do little segments about healthy relationships and the power and control wheel, ways in which we can work together.
How to talk to your kids.
How to talk to your kids about healthy relationships. And
Correct.
I have a couple of teenagers, and so, that's good conversation. So please feel free to reach out to us. You're welcome to email Gary at his email address, which is?
Gary@familylifecenterflagler.org.
Yep, and Gary will be sure to answer any emails you may have. You can email Trish at familylifecenterflagler.org, and we'll try and work something out around that. I hope you enjoyed.
Yeah, definitely. Before we let go, I just want to say, one of the things that I love about Family Life Center is, always giving back to the community. So if you feel like you have a little bit extra time, especially with, the mandates to stay at home, then volunteering is going to be the next best thing. You really get in tune to what it is and how we help the community when it comes to domestic violence and sexual assault. So please reach out to me if you are looking for some volunteer opportunities. Even with this, we do have some digital advocacy that we can present to you. And we can get you prepped for, once all this is over, go through the trainings, the statewide trainings, so that, you can come out swinging.
Well, we don't want them really swinging. We want them ready to roll.
You can come out and, just help our participants here in the county. So I appreciate you taking the time to talk to us, Trish. And I look forward to the next.
We're gonna do it again, Gary.
Talk, all right?
We're gonna do it again. Thanks so much, all of you out in the community who continue to support the Family Life Center. We are still accepting donations. We are happy to answer any questions you may have. So you can always call our administrative line if you need to, or reach out, like I said, to Gary and let him know what questions there are, and we'll answer whatever we can when we can. In the meantime, please, everybody, stay safe, stay healthy, and be well.